CAR T cell therapy is very exciting and I think is a groundbreaking research, and it has a lot of promise to cure children with acute lymphoblastic leukemia, which at times is hard to cure, especially in cases when they have disease come back during the treatment or after the treatment. So those patients tend to have a resistant leukemia, and many times chemotherapy does not work well. So in those kind of situations, CAR T cells probably are going to change the field, change the life of child. At least 50% of the patients go into complete remission after getting this therapy for a year. We don't have a long follow-up on these patients, so we have to wait for a few more years to really get a full picture. But based on the encouraging results, it is very likely that these patients not only are in remission, but they are cured as well. It's pretty much from having no options to a very good option. In terms of CAR T cells being used for other cancers, yes, there are ongoing studies where children with acute myeloid leukemia, those who have relapse or refractory disease, they hopefully will be getting CAR T cells in near future. CAR T cells have been used for multiple myeloma, and there have been some publications where it seems to be working well. Then there are patients with diffuse large B-cell lymphoma where CAR T cells seems to be effective, and it's expected that CAR T cells will get FDA approval for that indication as well down the road. And there are various other investigators who have tried CAR T cells for solid tumors. Results haven't been that great when you compare it with acute lymphoblastic leukemia. So I'm sure technology will get better in near future, and we will see more cure rates in not only leukemias but also in solid tumors. CAR T cells probably are going to change the landscape of how we treat relapsed and refractory leukemias. I think in near future, bone marrow transplantations will be replaced by CAR T cell therapies. The reason is that the bone marrow transplant is associated with significant long-term issues that these children face, because once the child is cured, they have another 50-60 years to live, and they will end up having a lot of long-term side effects from the bone marrow transplantation. So CAR T cells may have a better cure rates and less issues with long-term toxicities of transplant. We have a very large pediatric intensive care unit, and then we have a group of physicians who are very interested in dealing with cytokine release syndrome, which happens in many different conditions. When CAR T cells are infused, we don't anticipate too many reactions when the infusion is done. Typically, 1 or 2 days later, patients start to get fever, and when they get fever, there is a possibility that this cytokine release syndrome will happen, as a result of which patient will become very hypotensive. It means that their blood pressure will go down, and in order for us to manage their blood pressure, we have to transfer them to ICU. So we have a very good experience of managing cytokine release syndrome, and not only managing but curing patients and saving their lives. Several physicians have been trained by Novartis group, and most of the training has been to make sure everybody understands the risks associated with infusion of CAR T cells, especially the neurological toxicities, the cytokine release syndrome, and how to appropriately manage them. Because if we overmanage these symptoms, there is a risk that we will kill the CAR T cells, and that will make them ineffective in a way that leukemia can come back. So the training was to make sure that we understand optimal way of managing the side effect of CAR T cell infusion and do optimal timely management of the symptoms.